President Trump says he's going to love and cherish Social Security, Medicare, and Medicaid. And while we should be committed to helping Americans who rely on Medicare and Medicaid to get the best care they need, there are reforms that could help improve Medicaid's accountability and transparency and ensure that the right people are getting the right benefits. But before we talk about how Medicaid can better serve Americans, let's back up and look at what Medicaid is and how it differs from Medicare. Medicare is a federal healthcare program for people 65 years or older, as well as some younger people with qualifying disabilities. Medicare was created in 1965 to serve the older population, many of whom are retired and no longer have health insurance through their job. Medicare is funded mostly through federal subsidies that come out of your paycheck, and partially through premiums paid by those enrolled, and it's administered by the federal government. As of 2024, there were 66 million people enrolled in Medicare, and it was costing the federal government $1.1 trillion a year. What about Medicaid? Medicaid is a healthcare program intended to serve low-income people in several categories, including low-income pregnant women and low-income children. It was created in 1965 at the same time as Medicare. Unlike Medicare, which is a federally funded program, Medicaid is funded jointly by federal and state governments, and states administer the funds based on federal guidelines. Medicaid has a larger enrollment at 81 million people, but a lower cost at $833 billion combined between federal and state funding. Medicaid is an important safety net for the poor, but there are reforms that can make the program more effective for recipients and more efficient for the taxpayer's dollar. First, some states are using gimmicks and loopholes to minimize their share of the cost while maximizing the federal government's contribution. These loopholes need to be closed. Second, eligibility rules should be enforced and strengthened. It doesn't make sense to have people enrolled in a program who aren't supposed to be there, especially when it takes away care from those whom the program is intended to help, and the cost falls on American taxpayers. Third, federal funding should be amended so that it doesn't advantage one enrollee group over another. For example, Obamacare created an incentive for states to enroll one particular category, able-bodied childless adults, which prioritized enrollment for that new category over the traditional Medicaid populations like children, elderly, and disabled. That shouldn't be happening. Fourth, just like with other welfare programs, states should be able to condition enrollment of able-bodied adults on whether they're working or looking for work. The first Trump administration launched an initiative to encourage the states to do this, but the Biden administration repealed the agreements. Finally, Medicaid should allow enrollees to choose a care that is best for them and their families. Just like with education freedom, families should have the option to use Medicaid funds towards coverage that works best for each individual, instead of being forced into a one-size-fits-all approach. These common-sense reforms will help make Medicaid stronger and better equipped to serve the communities that need it most. With the national debt driving inflation for everyone, it makes sense to consider reforms that improve the effectiveness and efficiency of government programs like Medicaid.